Hello, my name is Dr. Nigel MacLennan. I've been practicing as a psychologist independently for about 35 years. I'm currently President-elect of the British Psychological Society, and with me today is someone who has been President of the British Psychological Society. Peter, over to you to introduce yourself.
Hi there, I'm Peter Kinderman. I'm currently Professor of Clinical Psychology at the University of Liverpool. I've worked for, I think, almost exactly 30 years now as a clinical psychologist. To be honest, all of that time sharing my job between academia and the NHS. I work pro bono for the NHS. And yeah, as you said, I was for a while President of the British Psychological Society. I've also been chair of the clinical division of that society. So yeah, so that's my background.
Peter, today we're going to discuss the role of agency or self-responsibility in the field of mental health. What do you think is the role of agency and self-responsibility in the field of mental health?
Well, I guess in part, I don't know, but I think it's an important and interesting topic to have. The reason why I'm interested in this is because quite a lot of my emphasis over the past 30 years of kind of academic and clinical work has been thinking about how we think about the concept of psychological well-being, mental health, and then bleeding into mental illness. And one of the arguments, not the only argument, but one of the arguments about a medicalized model of psychological well-being is that it does deal with issues of responsibility, blame, responsibility, capacity, autonomy. So we have decisions being made about people's healthcare under the auspices of the Mental Health Act, where their autonomy is deliberately overwritten by Act of Parliament. We also have the wider model where people are told, this is not your fault, it's the illness. And that crops up a lot in mental health care in psychiatry, that there's an underlying message that some actions, some behaviors, some thoughts, some issues are not considered fully the responsibility of the person because the concept of the mental illness absolves them of some responsibility. And you see that debate happening in the discussions quite a lot. So I'm interested in that, and I'm interested in what the implications are if you doubt that medical model of mental health. Where does it leave you in terms of responsibility?
So we have a situation where some people are thought to not have capacity because they're suffering from some kind of mental illness. The logical question then would be, what is the pathogen? What is the cause of this illness? And indeed, what is the medical explanation for this illness that is supposedly depriving someone of their capacity?
Well, yes, although I just go back a step, because the threshold of capacity is one threshold. But I think more generally, there's a message given, not that people have lost capacity, that has a particular, quite absolute, personal, but also legal meaning. But generally, that people say, I'm finding it difficult to concentrate on work. And the message is, well, don't feel bad about that. It's not your fault. You're suffering from depression, and that makes it difficult for you to concentrate on work. So much lower than the threshold of capacity, there's the idea of that our responsibility for some of the things we're experiencing is at least mediated by this illness. And I think you're absolutely right. Amongst many other questions, it raises the question of, okay, so if this this entity of depression, is having causal agency in that the depression, is meaning that you are less able to put the effort into work. What is the nature of this entity called depression, and how can it have causal agency absolving you of responsibility? What is its nature that enables you to do that? Now, if you have COVID, for instance, you may well phone up your employer and say, I'm really sorry, I can't come into work today. I'm exhausted. I have COVID. And they'll go, sorry, can you explain that in more detail? And you go, well, the pathological processes of COVID, the infection in my lungs, in my respiratory system, the response of my immune system means that it's left me very fatigued, and therefore it's very difficult for me to work. Is the same sort of process going on for those problems that we call mental health problems? And I think it's an interesting question.
So with COVID, of course, if you've known anyone who's suffered it, then you'll know it does leave people very, very drained. And we can point to the virus. We can detect the virus that's causing COVID. There seems to be quite a contrast in the field of mental health.
Yeah.
We don't seem to be able to point to a virus or a pathogen or indeed any other biochemical cause.
Absolutely. So one of the things that intrigues me here is that I grew up with a father and mother who were very deeply religious. And so one of the explanatory factors they had for why children die why mothers die in childbirth, why there are hurricanes that rip the roofs off poor people in Guatemala, why ships sink at sea was, this is the hand of God. So there's this agency stepping into a set of processes that give an explanation. So what you have with COVID is you have a medicalized explanation. I think it's true, right? I think there's all sorts of evidence for why that pathological process is leaving us drained of energy because of coronavirus infection. The assumption seems to be that when people are experiencing depression, and interestingly, when people are experiencing depression without there being an external cause. So if you're depressed because you've been put by some evil scientist like me on a tryptophan depleting diet, it's not depression, it's the consequence of the depletion of tryptophan through your diet. If you're depressed because you've got an underactive thyroid, then the underactive thyroid is stripping you of energy and motivation. If you're depressed following a road traffic accident and you've had a traumatic brain injury, then the damage to your brain is leading you to be fatigued and so forth. But then we have a rump of people for whom all of those biological pathogens, pathological processes, biological systems seem to be absent. There's no particular biological reason why they're depressed. If there were, you wouldn't say they're depressed. You'd say they've got an underactive thyroid. What we're left with is this thing where the person is fatigued and lacking in optimism and unmotivated is then reified to be a disease called depression, and then it has causal agency. And that's what I'm interested in, is that if my life is falling apart around me, if just the prospect of being governed by Boris Johnson for another 4 years is causing me to just feel like there's no point in carrying on, can we legitimately say, we have decided to call that state depression and therefore absolve you of the responsibility that would ordinarily follow if you go, look, I'm just fed up anymore. So I'm interested in that. I'm interested in whether by, in the same way as my father inventing God, by inventing clinical depression, we're giving a socially approved external locus for our behavior. And I wonder whether that's actually a good thing, given that when Jehovah's Witnesses knocked on my door and they say things like, what do you think about the prospect of heaven? I genuinely used to answer, I think it's a bad thing to put all of our faith in jam tomorrow. I think that the most moral and ethical thing to do is to sort out the mess we're in today, rather than hoping for some mythical land of unicorns in the future. And I think kind of a similar thing about mental health problems, which is I'm not in the business of blaming anybody for anything, but I am interested in whether we're inventing a fake system for absolving people of responsibility. And we should, in a sense, take a more equally compassionate, but less pathologizing approach to these issues.
Peter, if you were to estimate the percentage of people who go down with depression for whom there is no biological or viral or other physical cause that we can identify, what percentage would you say that would be? And I know that's a really big, difficult question, but please get your best estimate would be great.
So on the whole, I would suggest it's something around 95% of people.
Wow.
But it's more complicated than that, because so first of all, I think in terms of the logic of mental health diagnosis, there's a very, very weird thing going on here, whereby we know of lots of biological pathologies where depression is an outcome. Like I say, underactive thyroid, you might have an immune system problem.
Hepatitis disorders.
Exactly. So, and traumatic brain injury. So we know lots of biological processes. So there are lots of things happening in people where depression is a common outcome. Mm-hmm. And that's a very substantial, hormone problems, anemia, there are loads of biological processes. My point there is quite a subtle point, which is if there is a biological cause of somebody experiencing the psychological phenomenon of depression, good. We can understand that. You can take iron tablets, put your folate levels up, and maybe you'll get more energy and feel less depressed. Excellent, good. We've identified a biological route to feeling terrible, and we can do something about it. And I think that happens a lot, but that isn't quite the same as the phenomenon we're talking about, depression, which is an illness that people have separate from low iron levels, separate from traumatic brain injury. There remains this thing called depression. Now that's slightly different. So, to what extent are people who don't have all of those other physical ailments becoming depressed because of an abnormality in some biological system that we do not yet know that is causing this disorder called clinical depression? I would say it's probably about 5% of people, or a rough estimate, who have something weird with their serotonergic neurotransmitter, even inflammatory system. I think the vast majority of us who become depressed for very ordinary human reasons. The one caveat to that is, I think once you start to become depressed, of course, it's a biological process as much as any other. So when people are depressed, there are changes to the way that their brains are working, to the way that their thinking happens. There are probably endocrine, certainly neurotransmitter changes consequent upon becoming depressed, because everything that we do is a biological action.
It sounds to me as though you're suggesting that it could be a self-fulfilling vicious cycle, that once the depressive process is started, it seems to perhaps, and I'm putting words in your mouth a little bit here, it seems to perhaps start because of some environmental factor or some psychological factor, and then once that's going, the physiological processes which self-perpetuate seem to kick in. Is that what you're saying, roughly?
Yep, certainly. So, well, one of the things that's quite important, I think, just generally, in biology, let alone in psychology, is the idea of circular or possibly iterative processes. So the idea of this causes that is quite is possibly quite a restrictive way of thinking about these sorts of things. Instead, we need to think. So my partner Sarah Tai is very interested in the application of something called perceptual control theory to psychology. So it's a systems control model coming out of engineering systems and biological systems. And the idea is all about feedback loops. So it's not about variable A causing variable B. It's talking about how variance in variable B is related to variance in variable A, and what the feedback between those two systems, those two variables might be. And in depression, indeed for a lot of problems that lead people to get a diagnosis of mental health problems, you can see feedback loops. You can see control loops going on. One of the most famous ones is the idea that as people become depressed, they withdraw from social activities and from physical activities that maintain their mood. So as you become depressed, you pull away from your friends, you experience less pleasure from the events that used to cause you pleasure, you're less motivated to conduct them, you don't get in touch with people, and the consequence is you're more depressed, which makes it more difficult for you to engage in those activities, and you've got a nasty negative feedback loop happening. So you're absolutely right. Once the process starts, it's kind of inbuilt in the human system that there are dangerous negative feedback loops that we can get into. Not only the withdrawal from pleasant activities, but of course, Tim Beck later on started to think of this not in so much in behavioral terms, but more in cognitive terms, that the more depressed we get, the easier it is to think negative thoughts, and off the system goes. And I think, just reading into what you're saying, there's something interesting in there about responsibility, because you might be doing the thinking, but there's a pathway that led to you thinking in this particular way. And to what extent are you responsible for your thoughts? To what extent is somebody who was, has grown up in a particular household responsible for their political or religious views? In part, we're the product of the circumstances that shape us.
That's interesting. So if I read it correctly, you're suggesting that there may well be a point in the depressive feedback loop, the depressive cycle, that one no longer has agency over one's thoughts. One no longer has self-responsibility for one's thinking patterns, and that those thinking patterns are largely determined by loops, feedback systems that over which one has no control. Is that what you're suggesting?
Partly, I think what I'm suggesting is something even more complicated than that. So first of all, I don't think there are thresholds. I mean, there are legal thresholds, right? So the legal threshold of legal capacity is a very important one. You know, are you actually able to weigh up a decision that's facing you? And you know, we in society in the UK at the moment have some pretty well developed legal principles where at a very, very high level, a very high threshold, if you're unable to make the decisions for yourself, then we can make decisions for you. So that's one threshold. Below that, however, I don't see there as a point at which your responsibility, your moral responsibility for actions stops and the responsibility is passed to a depressive condition or even a depressive process. I think it's a lot more complicated than that, in the sense that I think that those processes that we're talking about here, you know, the idea that if you were to engage in fewer pleasant activities, your mood is likely to drop, lowering your motivation such that, I think that's just inherent in the feedback loop of humans. I don't think it's a thing that cuts in over a certain level of depression. That's just how we're built. I also think that, you know, we know, or at least we strongly believe, that the ways in which you make sense of the world influence your thinking, influence your mood. And that's important. But I think it's at least an open question whether you and I are fully responsible for the framework of understanding that we've developed about the world, because we have been taught things by both our experience and by our parents that cause us to look at the world in a particular way. So if I did grow up with one of Tim Beck's dysfunctional negative schemas, which is, say, for instance, that if I am a flawed person, then people will not love me, okay? And then I get a snotty letter from my boss saying, you failed to turn up at 3 lectures, you know, this is unacceptable, Peter. Then the sort of cognitive model of depression may well think, well, my assumption is if I'm not good enough, then I will not be loved. I'm clearly failed in something important, therefore it threatens the ability of other people to love me, and I become depressed. Now, if that were true, then that's a causal mechanism making me depressed. But am I responsible for that dysfunctional belief? I think is at least an open question. So my point is that we don't necessarily need, you're responsible for absolutely everything that happens in your life unless you're ill to solve or to give us a compassionate perspective on responsibility, agency, blame. I think we can start to analyze these things in more psychological terms and have a more nuanced approach to the idea of who's responsible for why you're thinking in the way that you do.
That begs the question very strongly in my mind, at least. To what extent are we responsible for our own beliefs? To what extent do we indeed, and I'm possibly going to go too far here, choose our own beliefs? And if we have responsibility for our beliefs and we don't take that responsibility, have we inadvertently set ourselves up for depression? And perhaps I could go the other way, but put a hypothesis in front of you for analysis. Perhaps if we take too much responsibility for our beliefs and we try and control things which, we believe that we can control things in the world which actually we can't control at all, then maybe that might be another route into depression. So I'm suggesting in extremis 2 routes to depression. One, we don't take any control of our beliefs and that leads us into a depressive cycle. Or 2, we take too much control. We believe we can control things, but actually we can't. And that leads us into a depressive cycle. What do you think?
I think that's got some merit. I'd need to think through it in detail before I kind of give it a seal of approval, but I think it's got merit. Just going back a step to your idea of do we choose what we believe? I mean, one of the things that does seem to be clear is that for quite a complicated and detailed reason, the way in which we come to conclusions about important things in the world is slightly, again, more nuanced and motivated than the evidence points in this direction. So what seems to be happening, I'm most familiar about this as a sort of framework when it comes to paranoid beliefs, beliefs that people are hurting you. One of the things that seems to happen is people, when an event occurs, we generate a number of plausible hypotheses about why it's occurred. And we then select from those plausible hypotheses those explanations that make most sense to us, that are most satisfying to us. And it does seem to be the case that part of that process is, first of all, we generate explanations that are available to us, and that's something that depends on what we've learned and what we've been exposed to and so forth. And some people will have different plausible scenarios in front of them. But the other thing we do is we select from those plausible scenarios those explanations that seem best to fit the scenario. But the best fit isn't only on the basis of evidence, it's also on the basis of the personal consequences of that. So what we see, certainly, we seem to be occurring is people, for instance, I don't know, bumping their car on a curb and damaging the tyre, and then getting out of the car and kind of going, damn, well, why is it not signposted? And they come up with an explanation for why it's not their fault they've done it. And, you know, looking on it as a psychologist, you have to think that person has run through the possibility that they've made a mistake in driving, but that's not a satisfactory explanation. So instead they go, bloody council should have filled the potholes. So we don't just process it like Arnold Schwarzenegger in Terminator and go, plausible hypotheses, data, 78% match, tentative conclusion. What we do is we go, yeah, that's not a very good explanation. That kind of leaves me responsible. I think I'll have another look for some other explanations. So the beliefs that we have are in part motivated. I mean, again, I think that's an element of religious beliefs. You know, why do people believe in a benevolent God? When, first of all, it's a ridiculous question. And if you did, for the sake of argument, pose it as a scientific question, the obvious evidence littering the universe is there's no such thing as a God. So why on earth? Well, because it serves for certain functions for people. There are reasons why we believe this over and above the evidence. So I think the idea of are we responsible for what we believe? Again, in simplistic terms, we're exposed to learning events that drive our beliefs. But secondly, there are psychological processes that we have which require us or motivate us to believe certain things in certain circumstances. So again, I would step away from the idea that we own all of the responsibility for our beliefs. I think they have come about for reasons.
That's interesting. I wonder whether or not there's a meta belief about self-responsibility, and if we hold that meta belief that we are largely responsible for our thoughts, feelings, and behaviours, then we'll behave in one particular way, or be more likely to behave in one particular way. But if we don't believe that we're responsible for our thoughts, feelings, and behaviours, we'll be much more likely to behave in other ways. I'm suggesting, I'm putting forward a hypothesis here that that maybe people who are more inclined to suffer from mental health problems have an absence of a belief around having control over their thoughts, feelings, and behaviours.
Well, so there is, so I mean, I'm reluctant to kind of, first of all, I'm reluctant to come up with any explanation that's on the lines of that particular group of people have. I think our explanations must be more along the lines of, you know, what is it about human beings that leave us all vulnerable to these sorts of problems rather than a particular group? But yes, I think there's a lot in it. There's a study that I came across recently. I haven't followed it up, but I should have done, of I think it was students at the University of Harvard were exposed to something called growth mindset explanations as part of their preparation for university life. And it seemed to be a very simple intervention that protected them against mental health problems in their first year at university. And the growth mindset idea is that any particular mental state that we have is itself a product of events and circumstances that have led to this state. So you are excited because, and you are depressed because, and you are losing touch with reality because. So there are reasons for it rather than, well, it's an illness. So there are kind of human stories that can lead us to explaining this particular mental state that we're in, but also that it won't necessarily persist, that it can change, that both external events and internal decisions can shift us. So if you are depressed at one particular time, first of all, life will change and things will move on, and your mood will be different tomorrow. But also, if you went for a run, it would change your level of depression. And saying there are things that you can do right now that change how you think is slightly different from saying the secret for curing depression is. So this idea that our mental states arise for reasons definitely exist, but then change dependent on both circumstances and what we do. There's this idea of the possibility of change, I think, is true, and it seems to protect people from mental health problems, presumably because when they became anxious or when they felt lonely or when they felt depressed, there was at least the hint that that was a fungible state rather than an illness state. And I think that's important.
Interesting. It seems to me that you're suggesting that the way we habitually attribute external events or indeed internal events can determine how well we manage our mental health. Extrapolating, those who attribute in empowering, constructive ways that lead to actions that they can take that will minimize their mental health problems are less likely, I'm speculating here, are less likely to have mental health problems. And those who attribute in such a way that that disempower them, that do not enable them to take constructive action, they would be much more likely to degenerate into mental health problems.
And we do have some evidence of that from so-called attributional style, that when people tend to explain events as being wholly negative with generalizable consequences and down to characterological factors in themselves, they tend to suffer more than people who explain negative events broadly in terms of temporary things, situational factors, circumstances that can change. And I think that also raises an important thing about this topic, which is the difference between blame and responsibility. So I wonder whether there's an issue whereby, well, we just need to disentangle those. So in some senses, you can see why to take personal blame for the origins of an event is similar to taking responsibility. But I think there are ways in which that's not necessarily precisely the case. And that's why I think these issues of blame, responsibility, and personal agency are not necessarily the same thing. So one of the things that I'm thinking is that the idea of an explanatory framework that we have for things that have happened in the past is not necessarily dictating what can happen in the future. They're closely related, but they're not the same thing. And this would apply to mental health problems as much as it would apply to heart disease. So, you know, if you got somebody who survives a heart attack, and they do all the blood work, and then you're seen by a cardiologist who goes, look, the thing is, Peter, you've been living basically off gin and sausages for 30 years, okay? You know, you're lucky to have survived because that's really not good for your coronary heart, your coronary health. If you want to live another 30 years, you need to make some serious changes to your lifestyle. And what I could do is to say, I completely and totally accept responsibility for the fact that I have up until now been damaging my health. I will also take responsibility for what happens in the future. And that's rather different from saying it's your fault, you're to blame. So the idea so I'm not sure that formulation is we morally condemn Peter for wasting NHS resources by having the temerity to seek help after having a heart attack, given that it's his fault he had a heart attack. We don't tend to say that, because what we know is that paradoxically that reduces forward-looking agency, because then, you know, just give up on the person. It's a characterological explanation, and it fails to separate these different issues of blame, responsibility, agency, action, and so forth. And I think lots of people would come away from a situation like that going, you know what? I think my lifestyle before the heart attack was pretty poor. What I'm going to do is commit to a different lifestyle in the future. And I think that, as a sense of personal responsibility, agency, action, is quite healthy, quite positive. Why that relates to this issue of mental illness is because it strikes me that it's possible to weave that into an illness scenario, which is to say, so here's the thing, Nigel, it's not your fault, but you've developed an illness called depression. Here's what you can do to get yourself out of it. That, you know, I understand the logic of that. You know, it's not your fault that you're depressed. It's an illness called depression, but here's what you can do. You know, go running, do psychotherapy, etc., etc., etc. There are things that you can do to get yourself out of this depressive state. But I think if we go down that route of suggesting that there are issues of personal agency that can help you recover from depression, it's very difficult for me to square that with a direct pathological model of depression. It's much easier to say, look, it's not your fault, okay? You're not really fully responsible for how you analyze the world. That's the product of your upbringing. The things that have happened to you, you may have had a role in this, but we can tease that out. But, things are what they are. The issue now is, what are you going to do in order to get out of it? Or what can we do to help you get out of this situation? Rather than either blame you for the situation and leave it to you, or say that it's an illness and therefore has zero to do with personal responsibility. I think we could be a bit more nuanced about the fact that you are not fully responsible for your outlook on life even. And yes, it's an important driver. So where the responsibility comes in is, I would say, slightly different, which is it's not a question of allocating blame for where we are now. It's a question of how much agency can we claim for ourselves, or how much agency can we help people recover such that they can take the steps to move forward.
Your line of reasoning here reminds me of that of Jerome D. Frank, the author of that famous book, Persuasion and Healing. Jerome's basic tenet was this: all psychological or indeed health interventions are fundamentally persuasive attempts to persuade people to change their behavior towards more constructive, empowering behaviors. And it sounds as though what you're looking for here is a persuasive model to get people to accept responsibility, but without them, excuse me, without them feeling as though that we're attributing blame to them.
Absolutely. So this is not even a metaphor. It's a parodic analogy of the situation. So you take 10 people, and you say and they wake up in the morning and they find themselves in a reasonably okay hotel in the middle of nowhere, and you or I saunter in and have a conversation with them, and we go, look, you are all suffering from depression. It's not your fault that you're suffering from depression, but we're here to help you get out of it. Depression is a very real blah 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 blah. But another sort of parodic analogy would be, we take 10 people and literally kidnap them off the streets. Okay, we stick them in a helicopter, fly them to this thing, drug them, and they wake up in the morning and we go, this is not your fault. We have kidnapped you. Nothing that's happened here is your fault. Now, of course, you're stuck in this place in the middle of nowhere. How are you going to get out of it? Now, obviously, there's going to be anger and there's going to be this, that, and the other. But what you can imagine is 10 people going, bastards, right, let's plan our way out of this hellhole. And in a sense, that's the situation that I'm talking about, which is, I don't think it's our fault that we found ourselves in these circumstances, but given that we happen to be self-aware human beings, we can use that to corral our understanding of the situation, our knowledge about our own capacities, our analysis of the situation to give us agency. So I don't think it's your fault that you've become depressed, but I do think you have a responsibility to muster that agency and personal responsibility to get out of it.
Yeah, I would agree with that from my own therapeutic experience. The vast majority of people that I see who are in the depressive loop, they simply didn't know that they were doing those things to themselves. They didn't know that they could improve their mood by doing basic exercise, that they could improve their mood by spending more time socializing, and so on and so on. But once they do have that knowledge, and they accept that they can do something about it, it seems to have a therapeutic effect in and of itself. In other words, before they've even started applying the techniques, just knowing that they have the techniques seems to lift their mood quite remarkably. What
yes, I think so. And I think one of the frustrations about these debates for me, and I know it's not the whole thing, and I know that the vast majority of my colleagues working in mental health are compassionate, but one of the things is that this idea of explanatory models, explanatory models in scientific terms, and then explanations for things that have happened, and then accounts for what is going on, and then thoughts about the future all seem to be muddled up in a way that is understandable, but I'm not sure that the frameworks of understanding that people have are the only ones possible. So for me, this idea of people going, well, so it happens in debates about medication, it happens in debates about diagnosis and so forth, which is, if we didn't tell people that they have clinical depression, what am I supposed to do? Just tell people that they're weak and lazy? So it seems to me that the debate is framed in terms of either people have personal responsibility or they don't. And it's kind of an absolutist thing. And what I'm trying to do here, and what I'm trying to think about is, can we talk about the responsibility that we have for sitting back and appraising the situation and our own role in the situation, thinking about whether there are alternative ways of thinking about the situation, considering our own actions and wondering whether there are alternatives, thinking about the consequences of what we do, separately from it's not your fault, it's an illness, separately from if you believe that, then you will become depressed, which is separate from, yes, but why did I grow up believing that? Even the issue of blaming parents and things like abuse, which is, I mean, obviously nobody's to blame for the abuse that they experienced, but there's a further element, which is those sorts of experiences shape the way that we look at the world. So in a sense, I'm not saying you're not responsible for your outlook on life. I think you're responsible for whom you vote. And if you voted for Boris Johnson, then shame on you. But I think it's interesting as to why people like me might have grown up with socialist outlooks on life, because I don't think as a one-day-old baby, I took the autonomous decision to become a socialist. I think I have been shaped by the things that happened to me.
Almost certainly. It seems as though you're suggesting, Peter, that that knowledge might be a mediating variable in self-responsibility. So let me flesh that out a little bit. If an individual didn't know about the things that could have a positive impact on their mental health and perhaps even an immunizing effect against things like depression, if they didn't have that knowledge, they couldn't have taken responsibility because there simply was no knowledge to apply. But the moment they have that knowledge, if they're motivated, then theoretically they could apply that knowledge and take responsibility. I'm wondering whether or not you're suggesting that knowledge is a mediating variable in taking self-responsibility.
Well, yes. I also think that there's an element of the nature of therapy. So one of the things that has happened is that, and I think this has been a long historical process of where in our society does care for people who are emotionally troubled fit? Is it a community thing? Is it an industrial thing? Is it a religious thing? Is it a medical thing? And at the moment, I think we're moving away from a sort of a pinnacle in sort of about 1958 probably, where care for people's emotional distress was seen as quintessentially a medical thing. I think now we're into a sort of multidisciplinary model, which is fine. I think there are other models that we could apply, and so in that context, the idea of therapy, as in sitting down with somebody who is troubled and helping them to feel better about themselves, is seen in quite a sort of medicalized approach. So the role of the therapist is to, depending on the therapeutic modality, but it's usually something along the lines of either using the relationship as a lever for change in one way or another, and helping the person recover from a problem. So there's elements of, cognitive behavioral therapy, CBT, being used, as effective as antidepressants. So got a person with a depression takes the antidepressants or takes the CBT or takes both and they get better. I think there are other modalities. So I think there's an educational modality where the therapist is more of a professor of helping the person learn new ways of understanding themselves and the world. Possibly a practical element of education, so almost educating but also training. So it's not knowledge, but it's new skills. So we hear CBT therapists talking about psychoeducation, so it's giving people knowledge or helping people learn things. And then you've got sort of skills acquisition, CBT skills, and that's good. You've also got the idea, I think, of more of a philosophical discussion. So therapy being a form of applied philosophy. So, what makes a good life? What would make us happy? What would make you happy? And an applied discussion about, why the world seems such a negative place, how to approach behaving differently. And it's possible to see that as a therapy coming out of the medicalized perspective. It's possible to see that as an education. I think one of the more valuable things is to think of these sorts of discussions, these sorts of therapeutic discussions, more philosophical than therapeutic. So I'm just slightly disputing the idea of knowledge and education, and focusing a little bit more on different ways of thinking.
Interesting. There's quite a large body of research in the field of psychotherapy, clinical psychology, and so on, that suggests that the biggest predictor of successful outcomes in therapy, and I know you know this stuff, is the quality of the rapport that the therapist has with the client. And it seems to sit above any therapeutic method. So in other words, it doesn't really matter which therapeutic method a therapist is using. The quality of the rapport that they form with the person that they're trying to help seems to come out ahead in terms of predicting successful outcomes. How would you explain that? That seems to suggest that almost anything we do is secondary to how well we get on with the person we're helping.
Yeah, but I think that makes perfect sense, especially if you demystify some of these phenomena. So you, instead of thinking about what the therapy might be for borderline personality disorder, we think why is this person's self-esteem fluctuating so wildly? Why are relationships so difficult to maintain? Why are the emotions so strong that even cutting yourself is a effective way of stopping yourself feeling these emotions? When we start sort of demystifying the clinical nature of these things, you start to get possibly better insights. And I think there is an argument to say that therapy might be about helping somebody approach the world differently, so doing things differently, and possibly thinking about their situation in ways that they haven't thought about before. So opening them up to new ways of thinking. And if that's true, then it doesn't matter so much whether the person is exposed to this form of therapy or that form of therapy, but they've got to be exposed, so with somebody, to thinking about their problems in ways that they haven't thought about them before, and being prepared to behave in ways that obviously haven't been ways that they've chosen up until now. So there's a degree of self-belief, there's a degree of optimism, there's a degree of trust. There's opening your mind up to other ways of thinking about things. And I think I would argue that probably embedded in the therapeutic relationship is a whole set of behaviors that a successful therapist is doing that allows the client to consider connections between emotions they haven't thought of before, to reflect on thoughts that enter into their mind when they're talking about a particular subject that they hadn't necessarily considered before, to learn to shift attention between these different parts or different aspects of their thinking, to contemplate new ways of thinking, and I guess to trust the therapist that it's worth giving it a try and seeing what happens. And so those would be the micro behaviors behind the therapeutic alliance for me.
It seems that if I was to try and extrapolate this, and I might be going a little bit too far here, if I am, please correct me. It sounds as though you're suggesting that the therapist, if they follow the appropriate behaviors that you were talking about, that they effectively persuade the client to make different choices. So I'm wondering whether or not psychotherapeutic intervention in clinical psychology might be, as Jerome D. Frank was suggesting, and you seem to now be suggesting something similar, it might actually be a persuasive process to persuade the client to change their behavior, to look at different modalities, different ways of thinking, making different choices. What do you think?
Yeah, I wrinkled my nose a bit at the idea of persuasion. I think there's creating a safe space where it's possible to think differently. I guess there's an overarching assumption in all of this, which is that there's power imbalances in these things as well. But if you are working as a rabbi or a practical philosopher with a consulting room, consulting philosopher would be an excellent profession to have. I think a nice little sort of Freudian consulting room in the middle of Chorlton, it'd be lovely. And then people come in and go, I've got an existential question about the nature of death. And you go, very interesting, Nigel, tell me more about your fears about death. It'd be great, right? So in there, I don't think I'm persuading you to think that life is inevitably finite, and the best thing you can do is to think how to maximize the benefit of the last remaining years of your life. I don't think I'm trying to persuade you of that. I'm trying to allow you the possibility of developing that way of thinking if it crops up. So this again comes back to the idea of, there's another element of this which is about responsibility and blame, which is, if I was a sports instructor, and you came to me and I said, so what can I do for you? And you go, well, this is really difficult for me, but basically I've had a heart attack and I need to get fit. If I go, yeah, it's your fault you had a heart attack, you need to accept responsibility for your blame in the heart attack. Well, I'm not going to be a very good gym instructor. If I go, absolutely, lots of people same position, very obesogenic society, we have arguments about car parking and we don't have arguments about cycle paths. Absolutely. Anyway, let's get started. You'll go, this is great. There's the possibility of change. There's the sense of optimism, a sense of personal agency. I can work with this guy to improve my health, and he doesn't blame me for what we both know is the truth. So I think this element of, I will take you at face value, and there'll be unconditional positive regard. That means not blaming you for the mistakes that you've made in the past, but looking at them in a straightforward way. Having trust in you that we'll work together to do something differently, and the optimism that we will find alternative ways of thinking and behaving. So, and I think all of that is wrapped up in the therapeutic relationship. And maybe we should have started off not being psychologists, but being philosophers, and now have a little chaise longue and a coffee machine and offering people philosophical counselling on the high street. I think it'd be great.
I think it's great that you can look at some this is extremely complex and painful subject with such humour. I'm sure most of the people who've been watching this video will enjoy that humour as well. Peter, I think we've reached a natural conclusion to this discussion about the role of self-agency in mental health. On behalf of everyone who's enjoyed this, thank you very, very much indeed for a stunningly insightful interview. Thank you.
My pleasure. Thank you.